Let me introduce him. We have with us then Dr. Carlos Geagea. So Carlos is a psychiatrist and he's the director of the inpatient psychiatric services at the Montreal Jewish General Hospital, so in Canada. You joined the department, Carlos, in 1973. Goodness, you must have just been a boy. We'll find out about that in a moment. But you're also an assistant professor in the Department of Psychiatry at McGill University. You are a most esteemed and experienced colleague to have with us. We're delighted that you're able to join us this evening. Thanks for coming. So, Carlos, let me start. How are you doing?
Can I first welcome everybody and tell the audience how delighted I am to be having this conversation with everybody. And I really want to take the opportunity as well to thank you, Simon, for the warmth that I have seen in you welcoming me and introducing me. And of course, to my goddaughter, with whom I wouldn't be here today, to Stephanie. So just to say that how delighted I am to participate in any way that I can, try to deal and make sense of the nonsense that we have experienced this past year.
Splendid.
Simon, I am ready to hear to what you would like to know.
Yeah, thank you so much, Carlos. You are most welcome.
Thank you.
So, Carlos, it might be really helpful for people to understand a little bit about, so what are you doing now? What's your role?
I am basically the head of the inpatient psychiatric unit. We have a 48-bedded unit in a general hospital. The Jewish General Hospital in Montreal is a general hospital and a hospital that has been designated particularly in the past year to basically treat and take care of patients who are COVID positive on the medical floors and so on. So this is a hospital that was designated as such because of the equipment that we have and so on. So, so basically in that hospital, I run a 48-bedded unit devoted specifically to people suffering from mental health. It is basically serious and severe mental health that are usually admitted. And basically, we have general psychiatry. We are 5 psychiatrists who are working on the inpatient services. I have been basically heading this unit since 1990. So yes, Simon, it's 73 I started, but 90 I became the head of the psychiatric unit. And it seems that as long as they are willing to keep me, I am delighted to continue doing that. Now, what in terms of my own practice, half of my time is basically devoted to treat people with severe mental illness. Okay. So these are people who are hospitalized and who are hospitalized because they are going through crises, or they are going through breakdowns, they are going through all kinds of difficult times. And predominantly, this population that I see in hospital are people suffering from schizophrenia, bipolar illness, what we used to call manic depressive illness, delusional disorders, people who are very much desperate in their lives and who need protection from themselves as from others. So this is the type of population that I look after in the hospital. So this represents about half of my work. The other half of my work is really devoted to open-ended psychotherapy, where I see different population. At that point, it's population that basically people who are conflicted, who have issues, who are not out of touch with reality as the first population, and who really can benefit from open-ended psychotherapy. So that represents the other half of my practice. So between the two, I kind of, it gives me, and then of course I administer the unit in terms of the admissions and the discharges and the response to a very busy emergency room, pressures from all around. So it is quite a busy practice, but if I am still there, it's a reflection that life has been good to me and I love it.
Well, thank you, Carlos, and I'm glad that it feels it's been good to you. You're doing a tremendous job in support of so many people. So tell us a bit about how you got there? Where does the journey begin for you to psychiatry?
You know, the journey was far from psychiatry when I did my medical school, and I had been destined, it seems, I didn't make a choice. From very early on, from when I was a child, my sense of who I am and what I will become was really to be a physician. The only thing is that my destiny was to really go and be a general surgeon. And this continued basically through my medical school. I did my medical school at the French Faculty of Medicine in Lebanon. And by the 5th year, when I went to a mental hospital in Lebanon to do my rotation, we do rotations in all fields of medicine.
Yeah.
So when I did my rotation in psychiatry, and really I was exposed to see people suffering from severe mental illness, as you would expect in mental hospitals. And when I began to see how they were creative in creating their own reality, dissociating themselves from our reality and creating their own, I really began to realize that this is something that really interests me. I was fascinated. I started to get fascinated by that. I still remember, I went and discussed it with my wife, and really she was delighted to hear of that interest. She felt that I am much more suited to be a psychiatrist than a general surgeon. And then I really found my calling. And from that point on, I decided that this is what I want to do. Simon, no need to tell you how difficult it was for people in the medical field at that time. I'm talking about 1967, 66. And at that time, to choose psychiatry when really kind of the expectation was otherwise, was a kind of wonder, if not disappointment, that what do you want to do psychiatry for? So that's really was the background. And then I applied to McGill Department of Psychiatry. And why did I apply to McGill? Because really McGill at that point had the reputation of really being an international center for neurology and psychiatry. And so when I came to McGill, I was very, very, really impressed to see that there were people from all over the world. In the 4 years of training that I did to become a psychiatrist after I finished my medical school, there were 4 years of psychiatric training that I had to do at McGill. And each year, there were close to 30 candidates that were training to become psychiatrists. And the amount of people that you met and you saw from all over the world is really an enriching experience. Okay. So basically, the environment was absolutely universal. Different cultures, different, and so from there, and you people as sociologists, you would really be able to appreciate what it is like to be exposed, to be in a center where really people from all over the world are together for the same purpose of becoming psychiatrists of a particular training. Now, this is really how I came to do psychiatry. And I did my psychiatry in 4 years. And then basically afterwards, I started to practice in Montreal.
Okay. So you said something terribly interesting, Carlos, that your wife thought you were suited to psychiatry. What had she spotted in you, do you think?
I think she kind of really saw my interest, especially in human contact. I think this personal contact was something that she saw, and it was interesting for her as well to hear me discuss with her psychiatry rather than surgery. So, and she when people ask her, she absolutely doesn't hesitate to say how much she was interested. And and basically happy to see me choose psychiatry.
Okay. So I understand you were saying, you know, psychiatry was a kind of lesser specialty at that point. Do you think that the kind of nature of the specialty is, and its status has changed much in the years you've been involved?
What I would tell you is that there is no doubt that the notion of stigma is there. Over the years, I really think things have changed a great deal. The contribution of the field in terms of really trying to understand the human mind, and from a biological point of view, as much as a psychological and sociological point of view, helped us to really understand a great deal as to what we are dealing with. The other thing is that a reflection of that things have changed. First, I am really impressed with your system, with the NHS, that basically at this point stresses the importance of biology and psychology in terms of psychotherapy, along with medication to treat depression and other kind of illnesses like that. But from my point of view, it's basically that a very, very important thing that happened here in Canada, and it must have been about 15 years ago, where for the first time, the Canadian government decided to create a federal commission dealing with mental health. So for the first time, there was a commission specifically designed to promote mental health and particularly to combat stigma. And when they did that, it is fascinating because I invited one time to our hospital the head of the commission to come and present their experience. And what he really told us is that he was absolutely surprised that when he started to see as to the origin of stigma, he realized that in order to combat that stigma and the stigmatization of mental health was to address two groups of people. One was the children, that the children, it's very important to really at this point kind of bring in them a sense as to appreciation of mental health. But what surprised him a lot is the second group that he felt they had to target, and this is the health workers. More than any other group, it was so important for that federal commission to begin to address that. So yes, over the years, there was a great deal of work and effort and understanding to destigmatize mental illness. But still, it is we have quite a work to do to really come to a point where mental illness is not considered anymore a source of people that they have to be ashamed and self-conscious and deny it and put it aside and feel that it is a sense of weakness. So from that point of view, I really feel that I would like to applaud people who are coming out to really talk about their struggle with mental illness. You can't imagine how many times in talks and so on, people would be listening to a conversation, a lecture, and so on, and then afterwards they come in private to tell you that they are struggling with this, or their family member is this, and what do you think? So clearly, all this is there. But what I want to applaud is the example, for instance, of Meghan Markle.
Oh yeah, yeah.
In her courage to come and to talk about her struggle with depression, her struggle with suicidal ideation, her asking for help, and the stigma that she felt because of the shame that it will bring, and to have the courage to, this is what really we need more. And it's happening. There are many, many public figures at this point that are much more open in terms of talking about their struggle with mental illness. I hope I'm not talking too much, am I?
No, not at all. Well, that's the purpose. That's the purpose, Carlos.
But because I have the tendency to go on and on.
I don't believe it for a moment. There's a couple of things I just would be really interested to backtrack. I think we really want to talk, unpick some of this about stigma and about people's self-presentation. But you're doing something really interesting in conjoining psychiatry and psychoanalysis as well. And I just wanted to pick that up, if I might, with you. So where does the interest, because psychoanalytic training is also an incredibly intense and long process, how does that fit into your kind of picture then? Of people's
in my training, the first year that I did my training, I went to Douglas Hospital, which is a mental hospital in Montreal, servicing predominantly the Anglophone community.
Okay.
It was a hospital of about 1,500 patients. And you were exposed at that point to severe mental illness but what was very, very special for me, and I would assume for anybody who has been to that hospital at that time, was to be exposed to a world-renowned psychiatrist by the name of Hild Bede. Hild Bede was a person who was born and grew up in Germany. He came in his 20s to Quebec, got married to a Quebecer. They had one son, and for the audience to realize that this man, who was internationally known, he is the one who introduced the first antipsychotic to North America, not just Canada and the US. And to realize that this man was living on the grounds of Douglas Hospital, on the grounds. It's beautiful grounds, by the way, but to have somebody devoting his life to really understanding mental illness at a time when really it was still difficult. So he really made a whole inroad in terms of understanding not only what schizophrenia is all about, but to understand how to treat it with medication and with humanity. So that was the biological bend that influenced me through a man that was really larger than life, internationally known, and so on, and with such humility that was a person that definitely inspired me. Now, when you talk about psychoanalytic thinking, you have to understand that at that time, any department of psychiatry in North America, the chief of the Department of Psychiatry was a psychoanalyst. So the psychoanalytic tradition was basically prevalent. After I finished my first year of residency at the Douglas and got really the basis and the ground in terms of what biology is and so on of mental illness, I was exposed to another larger than life figure that absolutely influenced all my career. His name was Henry Kravis. Henry Kravis belongs to the oral tradition. So if you are going to go and look for writings that he has done, there is very few. But what he has done was to influence generation after generation of future psychiatrists in terms of really who he was and what he instilled in us. And basically, so the two people that influenced me the most in terms of biology and the psychoanalytic understanding of people is Hild Bede and Henry Kravis. Now, Henry Kravis was, meaning to hear this man, you presented a case to him, so there will be a multidisciplinary team from all over, psychology, sociology, biology, nursing, occupational therapists, they all present their way of understanding a person that they are looking after. And then Kravitz would be listening to all this. He would smoke the pipe. And then the last 15 to 20 minutes out of the 1.5 hour session was really devoted to Kravitz. So Kravitz would start by putting his ideas together, and then came with the most beautiful expose of what the intricacy of the mind is, how you can bring all these views from different people, different points of view, how you can integrate them into a whole that represented the person. It was magic. So from that point of view, that's really as well. So there was this kind of sense, not only of understanding the mind, but basically instilling in you the inner humanity of all of us. He touched it. And that really was the inspiration for all my career, to be able to understand severe mental illness, but at the same time, to really understand that each person, and that was his teaching all along, it transcends diagnoses, that what we are talking about are human beings that are unique with their own sets, and that we have to connect to the humanity in them besides just the diagnosis and the medication.
It's beautiful. I mean, somebody once told me, a psychiatrist friend of mine said, it's the specialty where the art and the science come together the most. And that sense is redolent in what you're saying. I'm thinking about where we are.
Simon, that's well said. That's absolutely what it is.
I wish they were my words, but I've got one more question for you before perhaps we take a little break and then talk a bit about how people coped, and I'd like to hear about COVID. And somebody's already posted me a question, so I'm just letting you know, but also letting them know that I'm going to bring that forward shortly because it's such a great question. But what I wanted to just conclude this first half was asking, so you've talked about the kind of personal journey in the relation to other professionals and their inspirational nature. No, of course, we're not asking you inappropriately to disclose individual patients, but often physicians learn a lot from their patients. And I'm just wondering if there's been some seminal moments for you in your experience and development that really have arisen from that relationship that you might want to share with us?
Meaning, there are many, to really, you see, when you are doing open-ended therapy, it is, in contrast to psychoanalysis, where basically you are uncovering a whole civilization that's underneath. It's like an archaeologist who is really digging and trying to discover a whole civilization. What I do, I am very happy to discover just something that was hidden, an artifact or whatever that contributes to the understanding of the person. So from that point of view, it is constantly, it is always a discovery, an active process when you are trying to uncover what is going on. And that's particularly in my work in open-ended psychotherapy. But, of course, at that point, all the patients contribute and so on.
So I'm going to suggest we made you work hard for 20 minutes. Should we collectively just take 5 minutes break, everybody? And then we'll come back at perhaps 25 to 8, and I'd like to move the questioning on really then a bit to perhaps hearing a little bit about the experience under COVID, and then we've got a great set of questions really which are much more about what can we do for ourselves and others. So if everybody wants to just check out for 5 minutes, and we'll see you all shortly. Okay, bye for now. Here he is. Welcome back, Carlos.
Thank you.
Carlos, I thought if it's okay, we might spend 10 minutes or so before I share some of these wonderful questions with you, just hearing a bit about, the kind of impact that COVID has had in relation to kind of your practice and what you've seen in terms of people's mental health, perhaps.
I think it's really important to differentiate the impact, in my mind, the impact of COVID on the general public versus the mental health patients.
Mhm.
And I really think it's different. For instance, on the general public, I really think we went through phases. I think the first phase, meaning it's hard to believe that it's already a year
Yeah.
that we really have been confined in the way we did. And besides, meaning we stress a great deal the devastating aspect of COVID on our lives, but really it is an opportunity as well to celebrate
Okay.
our resilience.
Mm.
Our resilience to be at this point, a year later, still kind of dealing with it in a way that kept intact our lives and so on. Now, the devastating aspect is really is there, meaning, and we can be privileged whether where you are and then where I am here, to be living in countries that really kind of had some protection. I'm talking about socioeconomic factors and so on that kind of help people cope better. But the devastation around the world, meaning I hate to imagine what it must be like to be, I know that my country of origin, Lebanon, where there is not this social network and social protection that we see here, meaning is absolutely devastating. The country, meaning half of the people there, I never thought that will come a point where I see Lebanon, half of the population, struggling to find something to eat because it has been so devastating. So it is the COVID plus other things for sure, but definitely the COVID played a very big role in basically influencing the way we see ourselves, the way we see. It's like a fight over survival.
Yeah.
Meaning, when you think now of the vaccine and how we are, how the world is fighting for the vaccine and so on, and who gets it and who doesn't, and so on. It is a moment of truth to just look at ourselves, look at what's going on. The impact of on the public, meaning there is no doubt, meaning there was panic. But I think if you really look at it, the first few months of the pandemic was basically us putting ours together and trying to fight it. So there was this enthusiasm and optimism that we are going to beat it. And then as the months have gone on, and we are struggling with that chronic level of isolation and stress and confinement and fear of catching it, fear of communicating it, fear and so on. So the end result of it was that there was a really, I see it, a huge period of disillusionment that whatever we have done and so on. And then came the vaccine now, which is kind of bringing hope. But at the same time, we hear about variants and second variant and third wave and fourth wave. So, so it is a huge, huge stress and impact on people, on their lives. We have sacrificed a lot. But in essence, I feel that yes, there are some people who underwent many, many changes. I can think in particular of old age. The university students must have as well gone through tremendous amount of adjustment to the new reality that they faced, or on top of the stress of being in university and so on. But to me, the biggest tragedy here that we faced in Quebec and in Canada really is the elderly. The elderly who were in group homes and nursing homes and so on, and were hit by this like you can't imagine, where people were dying. It was, and isolated, not able to be dying alone. So this is a group in particular that I think was very, very affected by the pandemic. Another group that I think had as well many, many challenges are really the health workers who were looking after them. And I really think ultimately we are going to see a whole eclosion of basically post-traumatic stress disorders.
Yeah.
With being exposed to people that where you are helpless, you are feeling guilty that you can't do more than what you are doing. You are seeing people dying in front of you day after day by the massive mass graves, rather away from the loved ones, meaning it's a cruel, cruel virus.
Yeah.
So there are different, not to mention at this point, all the, and this must be absolutely your domain, you're the sociologist, as to how the socioeconomic things and so on, how they, all of a sudden it became politicized, meaning you must have a kind of thing to try to understand how all of a sudden a mask can become a source of discord in the society. Some people are for it, some people are against it. It's all politicized. Stigmatization, where isolation, where really basically you are seeing all this in front of your eyes, and racial tension that's already building up. You are seeing now here Asians, Americans that are being killed because of this. So all these things kind of really are sources of distress and concern. The other thing that we have seen, and just an example in terms of what we are facing here in Quebec, you know that in the past 7 days, 7 women were killed by conjugal violence. Basically, just because they were involved in relationships, one after the other, one day after next. We are seeing all these numbers of people and the increase in calls for help in terms of, so really the impact on society is beginning to show. And what you are really seeing is the irritability, the anger, the hostility, the depression, the hopelessness, the helplessness that some people are feeling is leading them to be basically a danger to themselves and to others. So yes, the social impact is going to be tremendous and enormous, and we really have to deal with it in mental health.
Okay. So Carlos, I'm just thinking where we are on the time as well and the questions, and that neatly leads us, I think, to ask you in such a kind of desperate picture in many ways, but a really honest appraisal you've given us. Some of the things we're being asked to think about or ask your advice on is how can people cope with some of that isolation that can arise, perhaps because of the COVID conditions and circumstances, but more broadly. What do you?
I think at this point, there has to be a very, very close collaboration between community services, between political leaders, between government agencies. The government is really an important thing here, play a huge role to really be aware of basically assessing the different situation and how to deal with it. So it is, and the health workers all together coming with a plan, not only for now, but as well for future, as to how we are going to basically provide the necessary support to different communities to really create a sense of harmony, to bring back notions of goodwill and love and so on to our life and well-being, And this has to be at a communal level and sociological level, it has to be prevalent. On the individual level, I think we have helplines, we have all kinds of things that people have to use.
Okay.
The idea of the stigma really at this point should have no place in preventing people from calling and saying, I need help.
Okay. That's a great call to action as well. I think the sense of inspiring in people the confidence to recognize that there are places that they can go and that their voices will be heard. Okay, thank you. So what about people who are supporting others? You know, I mean, that has a cost for them, but also, you know, it's that kind of feeling of the exhaustion for them, but also how do people go about being good supporters for others struggling with their mental health?
You know, at this point, you know, we value a great deal, and you can't imagine now how in my setting, how much we value the role of the peer support,
okay,
and the family support. So these two groups of people who really now it has become quite a subspecialty, where people who underwent the pain and the suffering from mental illness come to a point of stability where can be a tremendous inspiration and support to other people. And I see it in my work. When I am running a group with people who are talking about their pain and suffering, you can't imagine how effective it is when somebody who has gone through it is basically sharing with them their own experience.
Okay.
So this is where I see that people like Meghan Markle and so on, who really can at this point encourage people to seek help.
Yeah.
When you are facing changes, when you are beginning to recognize whether that you are really feeling anxious and more anxious and depressed, when you are feeling that you are having difficulty to concentrate, when you are feeling that you are extremely worried about things in life, when you are worried about your moods are swifting, going from highs to lows and so on, don't hesitate, seek help. And the help is available, the helplines and so on. And of course, technology used properly is really an important thing to consider. Now, having said that, the social media it has a role to play if it is constructive role. If it is for misinformation and disinformation and so on, and being used politically, that's a different story. But if it is properly used, it can be a very constructive agent to really kind of bring harmony around.
Okay, that's incredibly helpful. Thank you. I mean, I think the message I'm hearing is, you know, what can people do for themselves if they're either a supporter of somebody or themselves struggling is reach out. That's
Exactly.
Reach out.
Exactly.
Critical message here,
and don't be afraid to reach out. There is nothing shameful about it.
Yeah, thank you, Carlos. I've got a couple of other great questions here. I mean, so one that kind of connects takes us a slightly different direction is really a question we've been asked about, you know, where people might feel resistant to the diagnosis they've got and their treatment. You know, what that must happen, I guess. And what are the issues and how can people cope with that?
You mean with diagnosis that they are given?
Yeah.
You know, to me, the diagnosis is really a mean of communication.
Okay.
The diagnosis does not define you.
Mm-hmm.
The notion to say, I am my diagnosis is not true. You are a unique individual who has an illness, whatever. Now, let me tell you, meaning, you know, we try as much as possible to kind of come with the symptoms and so on to define a diagnosis, but there is nothing that's written in stone. And at the same time, the way I see diagnosis is that the more you know the individual, the better you are equipped that the two of you come to realize what is it that can be helpful at this point. In other words, the major thing is that how can I help?
Okay.
Rather than how am I going to define you as suffering from this?
Okay. Okay.
But really, you know, here as well, the notion of insight. In other words, we give a tremendous amount of importance for people to be aware as to what they are experiencing, what they are seeing, and so on, and because awareness, and that's really the most important thing that I can share with you in terms of what we hope will happen, is that awareness provides mastery.
Okay.
The more aware you are, the better equipped you are to deal with the challenges that you are facing.
It's poetry, Carlos. You do, not psychiatry. It's that elegant. And I think you've addressed a really interesting question that somebody raises here, which is about, you know, what are the kind of patterns or traits that you see in people that have been able to move on? And I think that's what you're pointing to, is it? A kind of ability to become both reconciled, I think I hear.
The relationship, the most powerful thing is that relationship between two human beings.
Yeah.
And if that is based on trust, and if that's based on basically understanding what it's all about, I really think it can provide the comfort to basically at one point being able on your own to use your own thing to comfort yourself. Because in the final analysis, that's what we want. You know, our destiny is to be happy. And we, you know, it's really to do whatever we can without being defensive about it, to just be happy. And let me tell you something, in order to be happy, we really have to reach out to other people and to be available to other people. Not afraid to ask, but not afraid to give.
Okay. Thank you, Carlos. We're moving towards a close, and I mean, I want to have an opportunity to say a few words of thanks at the end. But before we do, I mean, it's kind of like, you know, the unanswerable question, perhaps. So forgive me for asking it anyway. But, you know, are there some particular messages that you really would like people here to get, if it's maybe for their own struggle or for the people with other struggles that they're dealing with? What do you think would be that kind of message?
I'm sorry I missed that. Can you tell me again?
Yeah,
I heard my wife coughing there, so I was wondering. Yeah.
It was the kind of, you know, what's the message? What's the take-home message that we can give to people who are either struggling with their own mental health or supporting others struggling?
Hope. Hope is on the way.
Brilliant. Hope and help.
Really hope.
Yeah.
And no matter what the trials and tribulations are, there is always a way that one can overcome. It is, yes, we all are striving to become, but sometimes we as well, life has dealt with us things that we need to overcome.
Yeah. Okay, that's fantastic. Thank you. We've just got a couple of minutes left, and I'm sorry, there are all sorts of comments and questions coming in, and I just wanted to acknowledge those and say thank you to people who've posted them and those that have posted questions. I hope that in some way or shape or form I've managed to capture some of the essentials of those and relay them to Carlos. But there's something really special here to say by way of thanks, Carlos. I've got 3 things from being with you this evening, and I hope they're things that other people have felt. And they're this: I've heard from you about humanity, about the significance of that in your practice and your experience of that practice and with others. You also talked a lot about humility, about the approach to the treatment and care of ourselves and others as being a process of coming humble, of being open, of being responsive as a consequence of it. And you talked about hope, that it's never gone, right? That it's there. And I thought those were extraordinary. And the thing that's most struck me, perhaps above all in hearing you talk to us, It's the extent to which you as a person have grown alongside the others that you sat with and listened to. And I have to say personally, I feel I've grown tonight from being with you, Carlos. It's been an extraordinary and really valuable experience. The best possible start we could have had to thinking about looking after ourselves and looking after each other's. We have one thing that we say at a moment like this to the gorgeous and beautiful people like you that come and join us, and it's this: we send you Hild Bede love to you, your family, and all your patients. From
lovely.
Side.
Many thanks. Thank you. It's a pleasure, really, for me. I really enjoyed being with you.
Well,
with such hosts, it's really nice.
Well, we could talk all night, and maybe we'll have to have you back, I think. But it's been a great opener for us, and I want to say on behalf of everybody here at the college, a huge thank you to you for your time, your expertise, your generosity, and your beauty as a human being, if I might. And it's been wonderful. I do feel inspired and more confident at this myself. I also want to say a thanks to Steph for organising this and making it possible, for the conception, indeed, of this entire series that we're opening up with you. That's inspired. And of course, I want to say a massive thank you to the many friends and colleagues, students, alumni, and others who've joined us this evening to listen to this. To those that have contributed through questions, and those that have been so patient, and I hope have gathered something useful from our time with us all. We always conclude in the same way, which is with that thank you and saying, you have all been very, very much indeed Hild Bede.
Thank you.
Thank you, Carlos.
Thank you. I really appreciate it.
Thank you.
Thank you
Good
so
night,
much,
everybody.
Carlos.
Good night.
Thank you. Bye-bye.